Now, China, let's move to China for a second. So China,
Just one qualification,
yeah,
if I may. The French call it a bémol,
yeah,
a B flat, the extent to which they're empowering the patient, I put it out as a hypothesis for next week, is so tiny that let's not stand here and say that patients have power. But symbolically and
No.
theoretically, I agree with what you're saying, but in practice, since you were very concerned with practice when you started,
absolutely.
that little subsidy to a small part of the population is at best directional.
But
rather
if
than-
your daughter
Yep,
is about to die,
yes,
and I tell you, you have to go to this guy who just butchered my neighbor's daughter.
that's bad, but the
Okay.
problem is that so many of them die in the private sector, which remains
I
unregulated.
understand,
But this is all in preparation
Yeah.
for next week.
But then you now say, I'm gonna give you the choice of which butcher
Of
you
where you
want to
die.
go.
Yes.
Of where you're gonna go, okay? You know, I'm gonna give you the choice.
Well, it's a little bit like Milton Friedman is free to choose, right?
It's very empowering.
We're free to choose to sleep under the bridge.
But it's very empowering. It's very empowering. It's very disempowering not to have a choice at all.
I would say it may become empowering if, in fact, because you've talked earlier about the extent to which costs are going up in India, but one of the things that's
Yeah,
still striking when you look at it is
Still
how little India
Slow.
is still,
Yeah.
even controlling for its
yeah.
overall economy, and
Yeah.
so if it bumped up the total expenditure on these sorts of subsidies, then you might see some real
Absolutely.
empowerment.
Yeah.
The subsidies are very small, and the risk in India, this is just a comment, the risk in India is that they're gonna not like the 7-bar reform in Thailand, that the subsidy is gonna be below the cost level for
Yeah.
for the providers, and the providers will get smart very quickly and figure out ways not to let these people who are coming, like Medicare in US.
Medicaid, yeah.
No, Medicare.
Inclusive,
You know,
increasing
where a
in
lot of
Medicare
hospitals say
too.
that, you know, I mean, I'm not sure, I don't buy the story, but, you know, people complain that, you know, the hospitals are losing money on the Medicare, so, it may not be true.
I'm sorry to keep you staying
Yeah.
on this topic for a very long time, but to your point, I would say that maybe the government has like a huge role in providing quality as well. I mean, like, if they can improve their standards in providing quality in the public health sector, where the patient would not be scared to go and
Yeah.
get their treatments done, and I think that plays like a crucial role for any country. Like, we've studied about England and the
Sure.
UK system, NHS, and the Canada. So Germany, France, those governments are very accountable towards their citizens, which that kind of accountability is not there in India right now,
Sure.
because of so many factors, political corruption and all those.
The other thing I'll just say really quickly to reflect on when you talk about India and China subsequently as well, it's not just sort of government responsibility, but what level of government and the
Sure.
level of government capacity, because both India and China have decentralized responsibility both for financing and regulation quite a bit to the state and local levels.
So China, basically the health system fell apart, and then the Chinese government kind of gave up, like they did with the economy, you know? And basically it's kind of Wild West, where everybody does what they want. You know, some people get good care and other people don't get good care, and it's quite a complex thing. But you know, now there's a reform now, just happening right at this time right now, which really makes a big difference. So where is China looking for their model for reform? So India looked to Sweden for process engineering. Where is China looking? They have a very definite paradigm in their head, in the Chinese head. It's like there's one model they really like. It's Singapore. Okay, it's Singapore. Singapore. The Chinese like Singapore.
How do you
This.
expand?
Vacation.
That's really hard to expand because Singapore is such like a
Well, isn't-
special city.
Well, it is. It's a city-state, but the thing that they like about the Singapore model is that it's a model that's built very heavily on what's called individual responsibility. Okay, it's individual responsibility. So the way it works, let me give you just I have 2 more minutes, but I'll give you an example, 2 examples of how the Singapore system works. So you have a heart attack.
Not now, not in practice, in theory.
And you end up, you know, going to the hospital, okay, and you get treated for your heart attack, and then afterward, you have some little bureaucrats who sit around and say, okay, Victor Arden, this is interesting professor, has a wife who works, and his father was a lawyer, and etc. Okay, so the bill is 20,000. You have to pay 10,000 because you're a professor. You make enough money. You can pay 10,000, and your family can pay another 5 because you have a sister who whatever, and so they'll pay 5. And you have a medical savings account. We're going to take 3 out of your medical savings account, and that leaves 2. And those 2 will cover. There's a couple of things we'll cover under the insurance system. Okay, so that's it. That's your bill. You get one. He has some sort of other problem. $20,000 again. But he comes from a family kind of lovey-dovey. He hasn't worked himself for 20 years.
That's
So unlike, so unlike him.
His cousin died and his
Yeah.
parents are gone or whatever. But he did work before he became an alcoholic. He did work for a little bit. So he has some money saved up in his medical savings account. So in your case, the first 10 comes out of the Providence Fund. There's a Providence Fund, okay, and other parts come out of your medical savings account because you have a medical savings account, and you were quite successful before you became in Skid Road. So we're going to take 3 or 4 out of your medical savings
Although I
account.
am in the C-class ward, which does not have air conditioning,
That's
which is an issue in
choice.
Singapore, I'm
Exactly.
sure.
Yeah, exactly. It is. You open the windows. So that's how they do it. Each case is judged individually, not just on you, but on what they would call your family assets.
So it makes Chargemaster look like central planning.
It's very complicated, yeah, exactly.
And also, by the way, you can't get a straight answer from anyone who serves on one of those hospital committees about the criteria they will use
No.
for the subsidies.
You have no idea. No,
How
it's-
do they interact with all the Norwegians that do low wage labor in Singapore?
It depends on what kind of low wage labor, but if it's foreign domestic workers,
Yeah.
technically speaking, the families that employ them are their employers and have a responsibility under Singapore law to provide them with all of their care. If the care becomes very expensive, however, it probably means the person can't work, which means they've violated their employment contract, so they can just send them home. If they are one of the construction workers, it's very convenient. If they're one of the construction workers and they become injured, they technically have a compensation package that they can provide. However, the government will take a year to 2 years to process it, during which time you don't get paid, you don't get money, and you don't get any health care. But if you leave the country as a result of all that, it is evidence that you are giving up on your claim to compensation.
Right.
And it's also important to keep in mind that approximately 20% of the human beings living on that little island fall into this category.
So, but the thing is, notwithstanding those things, which are social, obviously inclusion problems, probably Singapore, and the reason I mention Singapore is I'm slightly biased, I think probably Singapore has the most sophisticated, comprehensive insurance system in the world.
It's a
think
fantastic
it's
healthcare
an
system for
amazing
the other
system.
80%.
Exactly, and I think we should all be lucky to have anything that gets close to the Singaporean system. They spend 3% of GDP on healthcare, and they have better health outcomes than we do in the US. Now, of course, that isn't related necessarily to healthcare.
Your food's better too.
Yeah, but amazing achievement, and of course the Chinese are looking at this and saying, this is very interesting. Why would we want to have an American health system? We don't want that. Why would we have a British one? We don't want that. That's where we came from. We had a common system before.
Although the 2009 reforms, I understand that they were mostly looking at some kind of it's very low subsidy, but really kind of the Chinese.
The Chinese, yeah.
A sort of a social insurance model for most of the
That's what they did
schemes
now.
that they
It's
developed.
just, I think, last fall, they just brought in the universal health insurance. So, they brought in universal health insurance. It's interesting, is that going to be universal health care? Let's come back to universal health care. So you brought in that universal health insurance, does that give you universal health care? Why not?
Not enough to cover costs.
Well, it may not be enough to cover costs, there may be also access problems to services, right? Because it could be you have insurance, but maybe you don't, it could be like Massachusetts, when Massachusetts went universal, and there weren't enough GPs, and you couldn't find a doctor. So this, so whenever you talk about insurance, you're talking about breadth, depth, and height, inclusion, and it's a trade-off. If you're poor countries and you give everybody something, it means everybody's gonna get nothing. Okay, if you have poor countries and you get all your resources to poor people who are poor, then the rich people or middle class isn't gonna get something. But somehow you have to spread that pie, and it's a question whether you spread the pie thinly or you accept the fact that it's not gonna be necessarily a single system. It's gonna be a multiple tier system which is not equitable or not equal. It could still be equitable, it's not equal. And so those are the important choices. So coming to reform, I guess my message is, it's very hard to talk about universal health care and reform if you don't know what within the universal health care you are reforming. What is the thing that's both, because all of these countries have universal health care, okay? So what is it you're actually reforming about the universal health care system that they have that isn't working? And I actually don't like the term universal health care, because I think it's become like health for all. But, I mean, it's a term, and it's a goal that I think is praiseworthy. And countries are struggling to do it, and I don't think there's any country in the world that, people always, I'm from Canada, and people always say, Canadians have the most wonderful system in the world. It's worse than the US. Why?
Wait times. Wait times.
Well, wait times, but even wait times is actually not. Usually when people compare US and Canada, it's because they get upset about financing, right? I mean, wait times is one of them, but it's usually finance. So why would the US be better than Canada? Because in Canada, it's 29% of health spending, or 28% of health spending is out of pocket, not covered by insurance. And in US, it's 25. So Canada is 3% worse than the US in terms of spending that's not protected.
And that's the criteria for good?
No, but it's one criteria for coverage, right?
Gross amount is lower, right?
Right.
I was gonna say percent of spending versus
Yeah.
actual amount.
Well, okay, but that's
Sorry.
because of,
Prices are low.
it's a richer
Yeah,
society,
that's what I mean.
it's a richer society, yes?
Are there differences in the costs per service or costs per product in like US and Canada?
Yeah,
Because that can offset
sure,
this difference.
it can offset, but let's come back to this, your comment, it depends on the total amount spent, right? So, since US has 50% of spending in the world, it must mean that US is the best country in the world, right? Because it spends the most.
She was actually making the opposite point.
That's not what I'm saying. I'm saying that people in the US probably, even though the percentage is the same, they probably spend more out of pocket in just dollar terms.
Things are more expensive here.
Yeah,
That's
price
where you
negotiation.
get
In dollar terms they do, because it's a richer country, and
Well, I'm
GDP
just
per
saying
capita
the
is
cost
higher.
of care,
Yeah.
you equalize it when you take the percentage.
He's saying it's a factor of inflation.
I see.
Yeah.
There's more money in the US, so everything costs.
So it just comes back to be careful, define what you're talking about, okay? I mean, I think one of the greatest comedy routines is actually listening to the congressional debates prior to Obama reform, and listening to some of the senators.
Even afterwards.
And some of the,
Even
I
afterwards.
still like to, YouTube some of these things and listening to the ignoramuses that are talking about, because it's extraordinary that you have intelligent people who are actually representing the population here, coming up with statements that
The
were
best part though is
completely
when
ridiculous.
during the Clinton reform, I was doing an analysis of all the hearings,
Yeah,
and you actually had some like verbatim quotes unintentionally from the hearings from the 1940s, the debate of the Truman Plan.
Absolutely.
They pretty much just had the same debate, just
Yeah.
the names changed, but all the claims were the same. So.
of course, in the current election, we've got greater entertainment value, so
Yes, but
don't have to-
whatever Donald Trump replaces Obamacare with is going to be terrific. That's
it's very hard to unscramble an omelet. And the Obamacare it's going to be very hard to unscramble it. So there's a certain aspect of Obamacare that's here to stay.
Well, as I
So-
explained to my class Tuesday evening, if you believe that God has something to do with intelligent design, it's fairly clear that God had nothing to do with the United States healthcare system. So but part of the issue of sunk costs and whether you sort of try to take on existing commitments is the debate between Bernie Sanders and Hillary Clinton, where
Yeah.
she's saying, "I'm not doing this again. I understand it's a mess, but this is what we've got, so we're gonna tinker with
We're
it.
gonna try to improve it,
Just
exactly.
stop talking to me about this other stuff.
So I think that's my closing note then, I think, because that's what I wanted to say about reform. So in reform, you have basically two types of reforms. One is what we call the Big Bang reform, and you probably already talked about that in the course. So one is a Big Bang reform where you really break the system and you come up with something that's totally new.
I think I used the term transformative reform,
Okay.
quoting Larry Brown at the very outset, as
Exactly.
opposed to system
As opposed to what I call incremental
improving,
reforms.
incremental reforms,
Reforms.
right.
And I think there are good examples across the world of both of these, and there may be times when it's appropriate to do the Big Bang reform, and there may be times that it's appropriate to do the incremental reforms. I would argue that the US, it was good that Obama did a Big Bang reform because they had been prevaricating and, not making a decision for over 100 years, okay?
Did he make a Big Bang reform?
Yeah, sort of,
It really depends. This
Yeah.
does get back to the definition of incrementalism versus non-incremental reform, because from the Bernie Sanders, we need Medicare for all perspective, this
Right.
was an incremental building, it was a patchwork
Sure.
on a patchwork. But from a perspective of looking at the role of government, particularly the role of the federal government in the healthcare system, it was a stunning
It was an earthquake.
transformation.
It was an earthquake, exactly, in the US context.
Yeah.
And then you have the opposite where people achieved universal healthcare in Europe, the French and the Germans, which was all done through incremental. There was no particular big bang thing anywhere. I mean, you can look at loss and whatever, but it was slow move toward better coverage, improvements here, so very incremental. The problem with incremental is that, if you have governments like in the US where you have swinging of the pendulum, we never get anywhere because, the incremental never takes you to where you want to go to because it's always 2 steps forward and 2 steps back. And so you go forward and then you wreck it in the next regime and then you go forward and you wreck it again. And US have had 100 years of this, basically, right? I mean, really no progress for a very long time. So. Yes.
All right, well, Alex, your job was to provoke and you did. So we now have a little time
To digest
to
and
respond and ask further questions. You've raised a number of issues. Well, first you've made some flat statements that need to be examined, and I'm not sure which ones we should do first. The British system is no good, doesn't work, and the Canadian system is worse than the American system. We have two people studying, one is not here, Jennifer, looking at Canada, who might want to respond to that. You're Canadian
it
yourself.
depends what province you're from.
I'm looking at BC.
Okay, I'm from BC, but then Quebec. So, but I'm actually from BC, Vancouver.
My family's from Okanagan.
Okay, yeah, I'm from Vancouver, US Winston.
And then there's the question of China looking to Singapore as the model, and yet also, I think one could argue, I don't know what you would say, that we'll take this up with China, very influenced by the insurance model and the social insurance model and the expansion of insurance without forced savings, but yes, making people pay. But my sense is that there's a movement to increase that coverage, and that it is
Absolutely,
quite a
yeah.
significant thing for a country of 1.3 billion to say that everybody will get coverage eventually, and everybody already now has a small amount of coverage. Highly inadequate, very inequitable. But I don't know if that's incremental or transformative or in your judgment. Obamacare.
Well, what I understand from
Yes.
the current Chinese is
Yeah.
that it is actually quite transformative because they're coming in with a pretty big reform right
Yeah,
now.
yeah.
It's going to affect billions of people, millions of people.
Right.
Like India, I mean, the India reform with RSBY was a pretty big bang reform.
Well,
To
my sense
include
of
to
that,
include the poor.
yeah, my sense is that that's much smaller, but I'd like to know what.
350 million people affected by it.
350 million?
Yeah.
But affected in a small, but it pays very little.
But
But
it's
yes,
it's
but
designed to give.
It's true, it's a lot of
it's-
people.
It's designed to give a large share of the
yeah,
population
that's-
access to care. That's
That's
the
a philosophical
But didn't
thing.
you argue a little bit earlier that there's a problem in how you split the pie, whether you
Oh, yeah,
give like
absolutely.
a lot
No, absolutely.
to a few, or, and that seems to be one of those cases where
Absolutely.
it may not be a huge reform
I'm
just
not
because the
thinking, I
pie
don't think
is
it's gonna
split
work
very thin.
necessarily, yeah. I don't think it's gonna work necessarily.
No, that fits in with the comment I was making before, which is that if you're going to have this to be meaningful in terms of empowering people to actually make choices and go to other
Sure.
providers that they think are more quality, you're going to have to revisit whether or not you ought to continue spending 4% of your GDP on healthcare as opposed to going up to, say, 6, which might be more reasonable.
My point related to that is that you might want also to consider whether you want to really empower fewer people, or you sort of want to semi-empower a huge amount of people. So, and that's,
Yeah,
I don't know which one's more
I was
effective or-
partly rejecting the trade-off in this, at least in the
Okay.
at least in the Indian context, suggesting that I don't think the relatively minimal financial protection offered by those reforms to a great number of people is as far as you could go. I think it's a matter of coming back at a sort of a national context and having a conversation about how much do we value healthcare. I mean, there are problems with the NHS, as we well know from looking at it. And one of the things that is different about the NHS is not so much, I think, the structure of having a national health service versus some other thing, but the British have historically just not spent a whole lot of money on healthcare. So not surprisingly, when it comes to things like kidney dialysis or heart surgeries, you have long queues, you can't really get it, and especially if you're outside of London, you can't get a lot of those things. They've just chosen to spend far less than the Germans or the Swiss or the French on healthcare services. So there is a degree to which these structural issues matter a whole lot, obviously. But it's also just a matter, especially when you're talking about some of the BRIC countries, about how little they're spending on care.
Yeah,
Yeah,
but I